everybody. Today we are focusing in on trigeminal neuralgia. This is a subject that is near and dear to me because I actually suffer from trigeminal neuralgia. Having MS, that is one of the also downfalls to having MS. I found this article online that describes in a little bit more detail than I can give, and it's partly because a lot of the stuff I forgot. I just experienced the pain. But we are going to be reading today from trigeminal neuralgia-info.com, and this subject, this page is Metafocus Guidebook on Trigeminal Neuralgia. So let's dive in, guys. What is trigeminal neuralgia? Trigeminal neuralgia is the most common facial pain syndrome that I didn't know. And it is often described as the most terrible pain known to man. That much I did know. The pain is so intolerable. It stops you dead in your tracks. You know, or at least I know, when it's coming on, and there's absolutely nothing I can do to stop it. I start to get a feeling in my lower lip, and in a matter of seconds, it radiates up to the trigeminal nerve, which is right over here, actually. It's the fifth cranial nerve. It is actually the largest cranial nerve. I learned that also by doing research and studying this. But let's get back to this. So, trigeminal neuralgia is categorized by a sudden attack of facial described as intense, sharp, like an electric shock. Remember I was telling you guys about that? Or a stabbing pain. Some may say it's like stabbing. Some may say, me personally, I think it's like an electrical shock. The best way for me to describe it to you, take a taser, put it in your mouth, turn it on. That's exactly what it is. Actually, you just want to magnify it to like 10. That's exactly what it feels like. So the pain is most commonly felt in the cheekbone, which it happens with me, the nose, the upper lip, and the teeth. And some people actually, it extends to their lower lip. So remember when I was telling you guys, and I just told you about it, I can feel it that's coming on because my lower lip will start to tingle. And then, like I said, in a matter of seconds, it's right up there to the nerve. And it is a sharp, stabbing, electrical pain. I guess I could say it's like a stabbing pain. But I just know it as, when I had to describe it to the doctor, I just told him it's like somebody was electrifying me. And yes, I've been electrocuted. The pain is usually felt on one side of the face, unilateral. So I got it mainly on the left side of my face. The right side of my face is fine, but it's mainly on the left side of my face. And like I just told you, it lasts for seconds or up to 2 minutes. And I have taken my phone, and when I felt it coming on, I used to have it programmed in my phone. I don't anymore. I'm actually going to do it again so you guys can see how I used to do it. And once I felt the pain coming on, I would grab my phone and I would go to the stopwatch and I would do the countdown. And I would focus, and I found that this helps out. It takes away from the pain in my mind. To focus on the clock and just truly pay attention to the clock. And then as it counts down to 1, I could feel it subsiding. Again, it's some say it's a mind trick. I just look at it as it helps me out. Trigeminal neuralgia is also called tick, and I might get this wrong, so you got to forgive me. Delorex, tick because there is a characteristic muscle spasm that typically accompanies the pain and attack. This right here, what you're seeing with me, is a muscle spasm. I am actually going on Tuesday to get Botox right in my eye area and the upper part of my cheek. And it actually will calm it down and bring it down, so I'll look normal. I get the weirdest looks. I get the weirdest looks, not from my coworkers because they kind of know what's going on, but people outside in the street. That's why I kind of don't smile, or I really don't talk, because this is all brought on by talking. But as we're speaking now, guys, although I've had the radio ablation, and we'll speak about that at another time, it's basically, I'm going to sum it up, it's basically numbing the nerve endings. And the video that I'm about to show you, it talks more about it in greater detail. So, but basically what happens to anything ablation, they're killing the nerve, the nerve that, or it's a pain blocker. I don't want to say killing. It's a pain blocker. So basically, they're burning off the section that hurts, as far as I know. And I'm not a doctor. So, but that's what I was told, and that's actually how I perceived it when I read up on it. So, patients with trigeminal neuralgia report that it's intermittent pain attacks, and it's truly anxiety. Just knowing that you really can't live a normal life because at any given time it could come on, and there's like I said, there's really nothing you could do to stop it because you know what's coming on. I have, let's see what's happening. What happened to me? I was scared to eat. I really couldn't talk. Any slight touch of my face would trigger the nerve. It would bring it on. I kid you not, I was driving one day, driving to work, and I almost got into a car accident because it came on and there was nothing I could do. I had to literally sit there with tears in my eyes and drive and go through it. This pain is no joke, guys. But listen, I don't want to hold you anymore. Let's try to get over to this video so you can see what I'm talking about. And I'm a one-man show tonight, so you guys got to forgive me. Thanks.
I would compare this pain. I mean, there is no comparison. This pain is so intense and so painful that it can't compare to any other pain I've ever had. I've had ankylosing spondylitis, rheumatoid arthritis of the spine since an early age. I went through a lot of pain and back pain with that. It doesn't compare with this pain. This pain is so intense that it'll drive you to your knees.
If I brush my teeth, there could be, even on the amounts of those pharmaceuticals I'm on now, there could be, there frequently are, little jolts of electricity if I try to brush my teeth. So on the upper right-hand side of my face, I just don't brush my teeth scarcely at all. Using a very small-sized child's soft toothbrush helps, but I just get very frightened that with the little jolts of pain, they could intensify because they could be warning pains of a large episode starting. Very similar things of trigger points, sometimes just of cold air brushing across my face, sometimes applying makeup to that side of my face, a kiss, sucking through a straw. Those kind of small jolts of electricity now make me very fearful of a large episode.
Trigeminal neuralgia is frequently described as one of the most painful afflictions known to man. It is a sharp, stabbing, pain that involves one side of the face. It typically comes on spontaneously in middle age or in the older years of life. It is usually brought on by or exacerbated by touching the face, by eating, or by chewing. And very, very typically, it is relieved completely, at least in the early stages, by a drug called carbamazepine. If that drug, also known as Tegretol, does not relieve the pain, there's a good chance we're not dealing with trigeminal neuralgia.
Well, the dentist, what he did was he x-rayed my teeth. He didn't see anything wrong. And I continued to go back to him with pain. And then his final thing for doing anything on that side was a root canal on my right side front tooth at that time. What I thought about it was, I thought, this root canal is not working. And he said that being a front tooth, it may take a little while for it to totally, deaden.
A dentist could do nothing for me. From that point, I went to several other ENT specialists, ear, nose, and throat. I even tried remedies on my own, going to a chiropractor and to an acupuncturist, anything to relieve the pain.
I thought it was perhaps a dental condition because the teeth in the upper right-hand side of my mouth, especially the back ones, felt this intense heat. So I thought perhaps it was a dental condition. And my dentist or an oral surgeon, neither one could relate it to any kind of dental problem, and recommended that I see this particular doctor who specialized in TMJ. This was in Amarillo, Texas. Well, this man told me it just wasn't TMJ and he didn't know what it was, and goodbye now, please.
Trigeminal neuralgia is not infrequently misdiagnosed in its early stages. And I think the most frequent confusion is over whether it's a dental disorder. We see a number of patients who have multiple teeth pulled or multiple root canals before the dentist finally realizes that dental work is not going to solve the problem. That's probably the most frequent misdiagnosis. Well, the diagnosis of trigeminal neuralgia is different than almost anything else we diagnose in neurosurgery, in that the physical examination is almost always normal, and imaging like MRI scans or CAT scans are also normal. So we make the diagnosis solely based, in most cases, on the patient's description of the pain. The characteristic description that we look for is pain on one side of the face that is described as sharp, stabbing, or electrical. Pain that is brought on by touching the face or by eating or chewing, we call that a trigger point. And pain that is relieved, at least in the early stages, by a drug called carbamazepine. If the patient relays that type of history, we can be very confident that the diagnosis of trigeminal neuralgia is correct and that the patient will be a good candidate for surgery. There are a number of surgical procedures that have been performed over the years for trigeminal neuralgia. Currently, we offer 3 at the University of Florida. For patients who are in good physical health and can tolerate general anesthesia, I believe the procedure of choice for trigeminal neuralgia is an operation called microvascular decompression. This was invented and popularized by a neurosurgeon by the name of Peter Janetta, who practiced for many years at the University of Pittsburgh. And this operation is now performed all over the world. It is done under general anesthesia. It involves making a small incision behind the ear on the side of the facial pain. We then remove an area of bone in that region that is slightly less than the size of a quarter. we open the covering of the brain, and using the operating microscope, we look directly at the trigeminal nerve as it comes out of the brain stem. And what we're looking for is an artery compressing and pulsating against that nerve. We believe that pulsation over a number of years wears down the lining of the nerve. We call that myelin. And when the myelin is worn off, the nerve short circuits so that normally innocuous stimuli, like touching the face, produce severe pain. If we find an artery and move it, and then insert a small pad to prevent the artery from coming back into contact with the nerve, the pain can be cured in the vast majority of cases without any facial numbness. That operation typically takes about 45 minutes, and most patients spend 2 nights in the hospital. They then spend a couple of weeks at home finishing their recuperation. That's the operation which we prefer to do whenever it's medically safe. If it's not medically safe because of extreme age or because of other medical conditions like heart disease, we prefer to do a simpler outpatient procedure called radiofrequency lesion. Radiofrequency lesion is again performed in the operating room, but we use a simple, quick-acting intravenous anesthetic to briefly put the patient to sleep, allowing us to painlessly insert a needle into the nerve. We then burn the nerve, and that will leave the patient with a feeling much like Novocaine in the area where they previously had pain. This operation typically takes about 15 minutes, and it's performed on an outpatient basis. It is very effective at relieving trigeminal neuralgia, but it has the drawback of facial numbness. And if the operation is successful, that facial numbness will be permanent. Most people like the facial numbness, at least they like it a lot more than the pain of trigeminal neuralgia. But some people don't like the numbness, and we call that anesthesia dolorosa or painful numbness. So, if we can do an operation that will not cause numbness, like the microvascular decompression, we prefer it. But if we don't have that option, radiofrequency lesion will get rid of the horrible pain of trigeminal neuralgia. The third procedure that we offer for trigeminal neuralgia is called radiosurgery. Radiosurgery is an outpatient procedure where we focus hundreds of very small beams of radiation on the trigeminal nerve through the intact skull. And that highly concentrated dose of radiation produces changes in the nerve and its lining that over the subsequent several months lead to pain relief in the majority of cases. There is less numbness after radiosurgery than after radiofrequency lesion, so some of our patients prefer to have radiosurgery as opposed to radiofrequency lesion if they're not a candidate for the first procedure, microvascular decompression. The biggest drawback of radiosurgery, the focused radiation treatment, is that it typically takes 6 to 8 weeks after the treatment before pain relief is achieved. So for patients who come in to see me with very, very severe pain, it's simply too long to wait, and we have to select something else. But for patients whose pain is reasonably controlled on medication, radiosurgery is a reasonable alternative. The most typical reaction that I get from a patient when I describe the surgical options is, "Can you do it today?" That's because this pain is so bad, and they typically have been treated so long with measures that are now ineffective, that they are quite literally desperate to have somebody do something to help them. Now, I think that must be tempered in some cases by understandable anxiety about going through surgery. And of course, we try to alleviate that as much as we possibly can by carefully describing exactly what we're going to do, the high success rate and the low risk of the procedure.
I met Dr. Friedman. He immediately gave me hope that this pain could go away. He explained everything to me, let me know the risks, but explained the benefits. and the success rate, and made me feel very comfortable that this is what I want to do.
I'm thinking about how grateful I am that he was here and could help me. And I've learned that there's a lot of other people that's in my condition. And I'm just grateful, very grateful.
I have a great excitement about getting rid of this pain and not being afraid to brush my teeth or snuggle with a child or suck on a straw or kiss my husband or being alarmed that I can't speak at some engagement I have accepted the invitation to speak with. I am very, very excited and eager for Dr. Friedman to get me rid of this problem. And I think Dr. Friedman can do that he's done it many times for others. And I'm just excited to get rid of it. I want this procedure done, over with, and I want to be set free.
Well, I think that trigeminal neuralgia surgery is one of the most rewarding areas in all of neurosurgery because it is a very, very severe pain disorder that we can successfully relieve in the vast majority of cases. So patients and their families are usually very happy with the result of surgery, and that's what being a doctor and being a neurosurgeon is all about. Patients come to Gainesville from great distances to have their trigeminal neuralgia treated. And that's simply because at this point there aren't a lot of neurosurgeons who are actually actively involved in the treatment of trigeminal neuralgia. They tend to be confined to a few regional centers scattered throughout the country. In order to find out if there's a neurosurgeon near you who can provide you with experienced, successful treatment, you probably should consider contacting the Trigeminal Neuralgia Association. The national headquarters of the TNA is in Gainesville. They have a website, and they can provide you with excellent information about the diagnosis and treatment of your disease and about the availability of experts to help you, hopefully close to your home.
So yeah, guys, this is real. This pain is so intense, and I know I keep saying it, but if I'm saying it, yeah, it's real. It's real. I just put this out there. 2 reasons. 1, I'm tired of hiding. 2, I know somebody else is going through it. I went through it for years. And I didn't know this was an actual problem. And to know that there was a problem and how I discovered it, I was sitting right at this desk right here. And it had to be about 3 in the morning. And I say that because the pain comes and goes so much that it would bother me not when I was asleep, but right before I went to sleep. So I was afraid to lay comfortably. And as we're speaking now, guys, I'm actually going through it right now. So, so I would just literally stay up, or I would pass out sitting in my chair and get ready to go to work. And I'd get these massive headaches, of course, because I wasn't sleeping, I wasn't eating properly. As far as me not eating, yeah, I dropped like 75 pounds. And if anybody, you guys know me, I'm a pretty big guy, or I was a pretty big guy. And to know that I could actually drop to that much weight, I was down to like 220 pounds. And that's coming from, I was at, 280? I'm sorry, yeah. No, I'm sorry. 290? Yeah, anyway, in that area. But this is real, man. This is so real. And I am going to fight to get as much information out there as I can, because just like I found out painfully, I don't want that happening to you. You may be going through it already. And if I could help you in any way, then I will. Listen, guys, it's been an absolute pleasure. I love y'all, and I thank you very much for joining me. Until next Sunday, take care.